Hello, my name is Vince. I'm going to be your nurse for today. We're going to be inserting some feedings through your NG tube, okay? So, first things first, can you state your full name and date of birth for me? Alright. And before we get started, I'm going to go ahead and check your orders. Feeding for 75 mLs per hour. So we're gonna check the NG tube length. Alright. And we're gonna compare it to the last documented finding, and it matches. Alright. So now we're gonna check your pH content. We're going to measure with the pH paper. We're going to want to make sure that it matches the colors between 4 and 6 so that it matches the acidity in the stomach. And just for reference, X-ray is the most accurate way to determine the placement of an NG tube. Alright. We're going to get back the content. Give it back to you. We're going to edit that again. So now we're going to flush with 30 cc's of water. We're going to change out our gloves, perform some hand hygiene again. Some new gloves on. We're going to prepare your feeding. Okay. Okay, so going back to check your medication again, and just every time you do check the medication, make sure you have the 5 rights in order. So you're going to have the right patient, the right order, the right dose, route, and time. Alright, so everything matches. And before we get started with your feeding, we're going to go ahead and label the bag so that we know when it was started and when the next person needs to change out the bag to prevent bacterial growth. Alright, and then we're going to want to make sure all the clamps are closed. And we're going to start feeding inside the bag. Now we will prime the tubing. And then we're going to connect it to the NG tube. will need to make sure the head of the bed is raised at least 45 degrees to prevent risk of aspiration. If you want more, that's fine too. So then we set the feeding rate to 75 mLs per hour. You can go ahead and turn it on. Press start and have it running. All right, how you feeling, sir? You doing okay? All right. And then just at the end, we're gonna want to make sure the bed's in the lowest position, and the head of the bed rails are up. And then we will remove the gloves, clean up our area of any messes, make sure the call bell's within reach. And do you need anything else before I go? No? Alright then. You want to make sure to do some hand hygiene before you leave the room, and we're all done.